broaden our outlook on COVID-19 now and look at the broader context in Africa, where there are warnings that the worst of the third wave is still to come. Let's speak to Dr. Thierno Balde. He is the Deputy Incident Manager for Emergency Response with the World Health Organization's regional office in Africa and joins us now from Brazzaville in the Republic of Congo. Doctor, grateful for your time. As I was saying, a warning in the last few days that the worst of the third wave is still on the way, at least where Africa is concerned. What is the biggest threat as far as COVID-19 is concerned in Africa?
Thank you and good afternoon. Thank you for the opportunity. I think the major challenge here is really the fast speed of the transmission of the COVID-19 cases in our region here, due mainly to new variants, notably the Delta variant, which has been circulating now in more than 10 or 20 countries in the continent here. So that point is really one of the major challenges. But at the meantime, also we know that the current situation is occurring in a context of really relaxing, mode of the population and with less adoption of the public health and social measures in many of the countries due to the fatigue. Africans has been going through this situation for the past 1.5 years and given also the limited distribution of the vaccine. All of those elements are really the one which are making the situation quite difficult. Because as I was saying, we are really seeing a quite of accelerated transmission in many African countries, and today we have almost 16 countries that we are counting in a resurgence mode, so having a kind of consecutive increase in number of 20% during the past 2 weeks.
And South Africa, where we are speaking to you from today, is the epicenter of Africa's coronavirus outbreak. At the moment, there are conversations ongoing about whether the country should keep current restrictions in place. Would it be wise for us to ease our lockdown?
I think that's the government and the national authorities are really doing their best for really trying to stop the transmission. And as you rightly mentioned, South Africa is one of the most affected countries, and notably the Gauteng province. And one of the main solution given, once again, the limitation in terms of vaccination in our region here is really to reinforce these restrictive measures, to stop the transmission of the virus. So it's something which needs to be contextualized, but definitely it's really one of the means to have these strict restrictions and also the adoption of the public health and social measures by the population, and also doing all of the necessary or the actions, for really saving life. Today, that many people are really hospitalized in many health centers, and then if we do continue in this space, that will be quite difficult. There will be major tensions within hospitals, and people will continue, suffering out of this disease. So the restriction of these of some of the activities of the society sometimes is necessary, but this has to be also definitely adapted and also, well explained, and to get the engagement of the community for adhering to the public health and social measures.
We're watching the United States or watching much of Europe relax COVID-19 regulations. In some parts of the world, the UK, for example, on the 19th of July, is expected to do away with the mandatory wearing of masks in public, right? But the difference between them and Africa is that they've vaccinated either majority or close to majority of their populations. When you look at Africa, only 1.6 vaccinations, 1.6 million percent. I beg your pardon, let me start that stat again. Only 1.6% of the African population has actually been vaccinated.
Yes, we have around 2% of the people in our region which has been vaccinated, and we know there is a really major challenges and major gaps into the procurement and distribution of the vaccine. But very recently, after a kind of virtual halt of the procurement of in our region, there have been some issues, definitely, and some solutions which are coming. And just over the past few weeks, almost 1.6 million of additional doses of vaccine has been delivered in Africa. And there are also an imminent, delivery of almost 20 million of additional vaccine for our continent through the donation of the U.S. government. Those are Pfizer vaccine and also G&G, Johnson & Johnson vaccines. So So I do think there is a need definitely, for increasing the quantity of the vaccine which are available, but are in between before getting really the right coverage in terms of vaccination of our population. We might need, to work on the other measures on which we can have a kind of leverage, which are again, the vaccination, which are the adoption of these public health measures, and also the adoption of these restrictive measures which has been adopted by some countries.
And I want to go back and just get the statistic that I was quoting earlier. Africa currently makes up 1.6% of vaccinations globally because only about 50 million vaccine doses have been administered. There is the issue of the TRIPS waiver, where South Africa and India, for example, are leading the charge to make sure that there's an easing of the rules around the manufacturing of vaccines and patent rules that are to the benefit of vaccine manufacturers. When you look at the pace at which that conversation is moving, is it moving fast enough to meet the desperation for these shots?
This is happening really in a quite complex situation. The vaccination production and distribution is a complex one, and it's really difficult where we are coming from really to accelerate, more than what we are doing. Many efforts have been conducted at different level, at global level, at regional level, between all of the required different partners for really accelerating the pace and also of the procurement of this vaccine and even the production, the local production of the vaccines. But as you know, this production of the COVID-19 vaccine started almost 1 year and a half, even in the most developed countries. And this process before coming at our level here in Africa, where the capacities are quite limited, this can take a bit of time. But there have been a lot of efforts which has been conducted, for both the procurement of the vaccine, the donation of the vaccine, but at the meantime also the establishment of local production of the vaccine in our region. And I do think with the recent, setting up of this hub in South Africa, all of these elements can help us probably for the future for responding better, more effectively, and more timely to deadly pandemic like the COVID-19 pandemic.
Final question then. In Africa, we've identified the Delta variant in about 10 African states. Now talk of Lambda variant, which was first identified in Peru. How devastating would the arrival of that variant be on the continent, especially because at this point there are questions around whether it is vaccine resistant?
Yes, we are at the World Health Organization. We are really trying to monitor all of these new variants that are occurring in our region. But for the time being, the majority of these variants are the Alpha, the Beta, and the Delta variants. The older variants are being monitored, and we are really trying to reinforce the capacities for doing more genomic sequencing in different countries in order to know exactly the nature, the scope, and the distribution of these variants within other countries. But again, I do think since this problem is not addressed that much globally, and where we are facing a different location, different countries where the vaccination is really not coming at a good level, there the risk of having new variants and the mutation of the virus is quite very important. So I do think all of the efforts need to be conducted for really stopping these transmission chain in different countries, in different geographic locations, including Africa, for limiting the distribution or the occurrence of these new variants.
Dr. Thierno Balde with the World Health Organization in Africa, speaking to us from Congo, Brazzaville. Thank you so much for your time, sir.
Thank you, my pleasure.